discussion of the sole of foot. We will discuss about the superficial structure of the sole of the foot. This is the left side lower limb, and here you can see this is the medial border over the tibia, and this is on that side there is a lateral border, there is a fibula. The fibrous flexor sheath or flexor retinaculum, which cover to the all the muscles of the flexor muscles, which goes from back of leg to the sole of foot, even neurovascular bundle, tibial nerve and positibial artery. Both are passes deep to the flexor retinaculum, and the deep muscles of the back of leg, which is passes from back of leg to the sole of foot. Underneath to the flexor retinaculum, it is called the porta pedis, and sometimes there is a compression of the tibial nerve underneath to the flexor retinaculum. It leads to there is a tarsal tunnel syndromes. Now the flexor retinaculum, which is attached, here you can see this is the flexor retinaculum. Anteriorly it is attached to the posterior border of the medial malleolus, and below it is attached to the medial tubercle of the calcaneum. And now the cutaneous, I have reflect the skin of the sole of the foot, and you can see here this is the fat, this is a superficial fascia, which is very thick as compared to the other part of the body, and it is divided by the fibrous septa in between, and it is act as a cushion to prevent the underlying structure, neurovascular structures of the foot. After that we have see the this is the deep fascia. It is a plantar aponeurosis. This plantar aponeurosis, which divide into the 5 digit, and it is goes inside the each digit up to the great to the little toes. And there is a plantar aponeurosis which divide into the 2 parts, superficial slip and deep slip. Superficial slip, which is goes to the dermis and mainly to the fatty area, and deep slips, which is further when we can reflect this plantar aponeurosis, the deep slip which makes the deep transverse metatarsal ligament. Right now we cannot see in here, and it also covering to the fibrous flexor muscles. It covering to the tendon of the fibrous flexor sheath of the tendon of the muscles of the sole of foot. And even this plantar aponeurosis, which divides the foot, sole of foot into the by the 2 vertical septa, medial and laterally by the lateral vertical septa. So it divides into the foot into the 3 compartment, medial compartment, in between below to it's the plantar aponeurosis, it is a middle compartment, and this one is from the lateral to lateral intermuscular septum, it is the lateral compartment of the sole of foot. Now later on we will see the dissect the sole of foot, and we can see the other structure. This is the first layer of the sole of foot, but we will discuss later on. Here you can see this is the abductor hallucis, this is the flexor digitorum brevis, and here there is a abductor digiti minimi, but we will discuss later on after dissection.